West Visayas State University. Excellence, creativity, and innovation. Service. The West Visayas State University is committed to provide quality service to student clients, partner communities, and organizations to actively participate in national transformation. The Taga West approaches every situation with a determination to succeed, having a constant commitment to being the best and or delivering the best. The hashtag WVSU Excels says, in WVSU, excellence is a way of life. The West Visayas State University is a research university advancing quality education towards social transformation and global recognition. It is committed to develop lifelong learners empowered to generate knowledge and technology and transform communities as agents of change. Faced with the following challenges: poverty in Western Visayas, despite its rich human and natural resources, the call for the SUCs to take more active role in extension, the growing threat to our local and global ecosystems, the need of strengthening local capabilities and attitudes for the development of a more empowered citizenry, the imperative to plan, implement development undertakings that are more relevant and responsive to the health and socio-economic needs of the people. The university is working towards the attainment of goal number 3, that is, to develop and package high-impact research-based extension programs responsive to the needs of the community. Extension is an inherent function of the West Visayas State University with the purpose of catalyzing and sustaining the development of various communities. It aims to institutionalize the transfer of mature technologies to enhance productivity and address societal needs, intensify collaborative inter- and multidisciplinary extension engagements, and to strengthen stakeholders' involvement and sense of ownership to ensure community development and sustainability. The WVSU extension programs and projects have 4 thrusts, namely health, environment, livelihood, and pedagogy in its HELP Help program. It uses multidisciplinary and needs-based approaches that are offered by various academic units. The enhancement of the 4 multidisciplinary areas is guided by the national government socio-economic agenda as well as regional development agenda as a key direction in making socio-economic growth more inclusive and poverty reducing. Guided by the extension thrusts on health, environment, livelihood, and pedagogy, the College of Nursing Extension Unit, with a strong participation of community stakeholders and partners, is working towards the accomplishment of the extension aspiration, which is to empower communities. The university has a manual for extension operations, which is a simple and concise guide for WVSU extensionists as they navigate the challenging and dynamic world of university extension and development in 5 phases, from pre-planning, strategic planning, preparation and production on extension, specifically the production of information, education, and communication materials, program, project implementation, and monitoring, evaluation, and re-planning. The university extension has evolved with the changing times and rapidly evolving socio-political milieu, as well as new directions, goals, and priorities set by the university. All through the years, the College of Nursing's Research and Extension Unit has largely contributed to the attainment of the university's vision, mission, and goals. The extension work is an important component in the process of community development. The primary focus is the dissemination of information to rural and depressed areas to enable them to solve their problems, especially those pertaining to the improvement of the quality of their lives. The College of Nursing offers a curriculum that is community-based and competency-oriented. The CON Extension Unit delivers health services that are in response to the needs of the communities she is working with and in congruence with the programs of the Department of Health. The principles of primary health care and community organization and participatory action research, as well as the nursing process, are utilized in order that appropriate health services and nursing care delivered to the partners in health development. The approved extension program of the College of Nursing is entitled HEART, which stands for Health, Education, Action, Reform, Thrusts. Its goal is to unleash the empowering capacity of people to become self-reliant in terms of health or to place health in their hands. Its specific objective is to educate people in terms of health. The activities of HEART include community diagnosis, needs assessment, skills training, seminars and lectures, and impact assessments. Throughout the years, a health forest series was conducted among partner communities through community assembly, focus group discussions, lectures, seminars, training, demonstration, and return demonstration, storytelling, role-playing, and puppet show. There were various projects under the HEART program, namely Araw Pambata, community-based health program working with 4 barangays in the district of La Paz, Iloilo City, namely Magsaysay, Nabitasan, Rizal, and San Nicolas. Healthy Elderly for a Reformed Tomorrow, and Heart for Life, working with Bigke Leganes, Iloilo. Health Education for a Reformed Tomorrow, with other barangays requesting for the health services of the college GK NARS or Gawad Kalinga nurses advocating for reform services, working with Rasti Cacho Gawad Kalinga Village in San Isidro, Haro, Iloilo City. In 2017, the Let's Pitch In project under the HEART program was launched. HEART, Health Education, Action, Reform, Thrusts. Let's Pitch In, Partnership to Improve and Transform Community Health from the year 2017 to 2020. The Let's Pitch In program's objective is to unleash the empowering capacity of people and placing health in the hands of the Ilonggos. The College of Nursing had expanded its extension program to a new municipality and targeted the co-partners in the grassroots level and addressed their needs to be empowered regarding health and health-related concerns so that they can have self-reliance in terms of health and community development. The CON, through the Let's Pitch In project, worked with barangay poblasyon in the municipality of Badyangan, Iloilo. The municipality of Badyangan, located about 40 kilometers north of Iloilo City, is a fourth-class municipality in the province of Iloilo. It is listed among the top 10 municipalities with the highest prevalence of malnutrition in the province. The CON had worked with the partner community utilizing the COPAR to transfer knowledge and simple nursing skills to the residents to realize its vision of putting health in the hands of people. A needs assessment was conducted through a house-to-house survey to interview household heads to gather relevant data on family and household characteristics, economics and social characteristics, housing and environmental conditions, health practices, personal hygiene, treatment and management of illness and utilization of health services. The community partner was actively involved in the planning of relevant activities to respond to the actual needs of the community. The need to increase awareness on health promotion and illness prevention, the need to enhance capability to respond to emergencies and disasters, livelihood opportunities, and health services. Guided by the university's extension thrusts on health, environment, livelihood, and pedagogy, the four gloved projects of the Let's Pitch In program was born. Kalusugan, karunungan, kabuhayan, kahandaan. An impact assessment of the Let's Pitch In program was done. The clients have expressed their appreciation of the knowledge that the WVSU College of Nursing had shared with them through health education activities. In 2020, the Race of Hope program was proposed and was approved for implementation from January 2021 onwards. Working with the community partners and stakeholders, the Race of Hope program was born. The Race of Hope is envisioned to assist members of Barangay Alabidhan, Bingawan, Iloilo to achieve optimum health of each resident, especially on the promotive, preventive, and preservation aspects, utilizing mature technology and sharing research outputs of the faculty members. It will deal with the different features of barangay development and will focus on the family being the smallest unit of our society. It will start with education of the family on matters regarding home and family health, followed by opportunities that would stem from livelihood activities, peace and partnership so that harmony in the community is experienced, and environmental health. CON cares. The city of Iloilo has been placed on modified enhanced community quarantine from May 23 until July 15, 2001. Due to the surge in COVID-19 cases, the city's quarantine status was elevated to the most restricted enhanced community quarantine until October 15, 2021. The quarantine restrictions have affected many families, especially those who belong to the poorest communities, not only physically, mentally, and emotionally, but also financially. In response to the societal needs brought about by the pandemic, the CON Community Assistance and Relief through Extension Services was born. The Extension Unit has reached out to the faculty, staff, students, alumni, and friends of the College of Nursing for the Nations. After the call of the nations was published in the WVSU CON Cares Facebook page, many responded to the call. We have generated 65,000 pesos, 20 boxes of face masks, and 2 sacks of rice for the community pantry. The CON Extension Unit has partnered with the Commission of Mission of the Haro Archdiocese and the Espousal of Our Lady of Parish in Mandurriao, Iloilo City to serve the indigents of the Mandurriao district. In 4 days, CON Cares, through a Kristiyano nga kabalaka para sa mga kubus program, has served 614 indigents. Food were distributed through the community pantry. COVID-19 health kits that contain face masks, face shields, alcohol, and tissues were also distributed. Considering the restrictions brought about by the pandemic, health education was done through a comics on COVID-19. This innovation was made possible as an application of a research conducted by one of our Master of Arts in Nursing students, Miss Roseville Galvez, which concluded that comics is an effective IEC material for health education. Brigada West and V Comics was developed to provide information on COVID-19, what it is, its signs and symptoms, and prevention. 100% of the CON faculty and staff and some students have participated in the CON Cares activity, which was evaluated by 95% of the recipients as best, which means that the extension services offered were beyond their expectations. The CON Extension Unit has also conducted outreach activities in response to specific needs of the community. Some of the activities conducted were awards and recognition. The College of Nursing boasts of two most outstanding extensionists of WVSU in the person of Professor Virginia F. Federizo and Professor Zenita Glenda A. Plaga, former extension coordinators of the college. At dawn, Nightingale had a dream that inspired her to make it a reality. She stood up and delivered heart to the people, a heart that can see, a heart with a vision, a heart that listens, that feels, and a heart that cares. The Nightingales of the West Visayas State University College of Nursing bring heart of health education, action reform thrusts to the people. Our co-partners in health and development express the impact of Let's Pitch in their lives by verbalizing. These testimonies spelled self-reliance, change, and transformation. Indeed, Let's Pitch In made a home run. As we face the war against COVID-19, the College of Nursing spearheaded the CON Cares with the Haro Archdiocese in Kristiyano nga kabalaka sa mga kubos. We are grateful to all our benevolent donors and to the selfless people who extended their assistance to this heartwarming endeavor which painted smiles and even brought tears to many. Though CON Cares had concluded, CON will continue to serve and care for the people. This year, CON brings forth Rays of Hope, a new extension program in the forefront. Hope that will again bring transformation in the lives of many, both the extensionists and the clients. We hope that through Rays of Hope, our college will again bring transformation in the lives of people, and we can unleash the capacity of people and bring empowerment.